So for everyone's information, just be aware of that. If you have a question, as I think you heard me say a bit earlier, you have two options. One, you can use the Q&A tool on your webinar toolbar at the bottom, and you can text in a question using the Q&A tool. I'll be monitoring that throughout the presentation today, and we'll be able to let the panelists know about your question. The second is you can raise your hand, and I will be glad to unmute you, and you can ask the question directly to the panelists verbally. So you have those two options. We encourage you to use either one or both of those. I want to thank the Federal Office of Rural Health Policy and their hard work that they've been engaged in since the beginning of this pandemic in trying to make sure that providers in rural communities across the United States have resources to be able to carry on your missions in your rural communities. We started a year ago, over a year ago, if you can believe it, looking at trying to just find the resources to sustain your facilities during the time that we were terminating services for the purposes of making sure that we kept our patients and communities safe. This led to a huge lapse in the ability of meeting financial obligations, which then, of course, generated a lot of discussions over how we would engage the providers in those grant opportunities. Then, obviously, with the passage of the American Rescue Plan, a lot of resources were made available, and I'm just delighted to be joined today in this discussion by two representatives from the Federal Office of Rural Health Policy. The first is Michael Folicaire. He is the Principal Advisor for Impact and Planning for FRHP, which is a part of the Health Resources Services Administration. He helps to lead the work of FRHP, which is charged with advising the Secretary of HHS on rural health issues and improving the delivery of rural health care. Michael previously served as the Executive Officer in the HHS Immediate Office of the Secretary and as Deputy Director of the Community-Based Division within the federal office. He's worked in other agencies of the federal government, and so he brings a lot of experience with that work with him to FRHP. He has an undergraduate degree from University of Maryland at College Park and an MPH with a concentration in health policy from the George Washington University. He'll be joined by Lindsay Ninstedt, who serves as the Public Health Analyst for the federal office in the HRSA. And Lindsay basically is the program coordinator for the Rural Health Clinic COVID-19 testing program, the Rural Health Clinic COVID-19 testing and mitigation program, and as if that's not enough, the Rural Health Clinic Vaccine Confidence Program. She is a project officer for the Policy Research Division, where she supports the federal office's policy analysis and extramural research as the behavioral and substance use disorder subject matter expert and the rural health clinic subject matter expert. She's a rural Wisconsin native, and she came into government as a congressional intern. So she came over from the political side and has experience in the United States Senate and the House of Representatives. She has a bachelor's degree. She has experience in rural. She has an economics policy at Washington University in St. Louis and the Centene Corporation. She has an undergraduate degree in poli-sci and women's studies from the University of Wisconsin at Madison, and a master's of public health and a master's in social work with a concentration in mental health from the Washington University in St. Louis. And now, without any further introduction, it is my pleasure to turn the podium over to Michael, who will continue on with the program today.
Thank you, Brock.
You're welcome.
First of all, I appreciate the opportunity to speak to the National Rural Health Association members. You know, folks who've been with NRHA for a while know that FRHP really and truly appreciates the work that everyone does in rural. We know it's not easy. We know that sometimes it can be quite difficult actually with small resources, but we know that everyone comes together with often really creative and innovative ideas. So kind of what we're talking about here is actually an announcement of a lot of funding. The Department of Health and Human Services several weeks ago announced nearly $1 billion of the American Rescue Plan would be available to strengthen the COVID-19 response efforts and increase vaccinations in rural communities. Now, as Brock said, the Health Resources and Services Administration is a part of Department of Health and Human Services, HHS, and we will increase the number of vaccines sent to rural communities. We're aiming to expand testing and other COVID-19 prevention services and to work to increase vaccine confidence by trusting the trusted local voices with additional funding for outreach efforts in underserved communities. Because rural health clinics and small rural hospitals are trusted messengers in rural communities and provide consistent fact-based public health messaging, the RHC, the Rural Health Clinic COVID-19 programs that we'll be talking about will help rural communities make informed decisions about their health and COVID-19, including steps on protecting themselves and their communities. So all these programs will improve our healthcare in rural areas and really help to reinforce the messages about the prevention of COVID-19 and other infectious diseases. So I'm going to turn to Lindsay to talk to you about the Rural Health Clinic Vaccine Confidence Program. Lindsay?
Thanks, Michael. So the Rural Health Clinic Vaccine Confidence Program through the HRSA will make nearly $100 million available in grants to eligible rural health clinics nationwide in order to address health equity gaps by offering support and resources to those medically underserved rural communities where COVID-19 vaccine uptake lags in comparison to some more populated areas in the country. So the Rural Health Clinic Vaccine Confidence Program is the first targeted rural health clinic grant since the passage of the Rural Health Clinic Service Act in 1977. So we're really excited about the program. We also understand that many rural health clinics might be first-time grantees, unless you've applied for other programs that were not dedicated to rural health clinics. So this program will allow rural health clinics to use funding for a broad range of efforts to improve healthcare in the rural areas and reinforce basic messages about prevention and treatment of COVID-19 and other infectious diseases. Some of the activities that it will include are vaccine promotion, information dissemination to rural residents about how and where to get vaccinated, coordinating with existing vaccination sites and public health partners to identify isolated and or vaccine hesitant populations, and increase rural community and individual patient literacy on benefits of broad vaccination and the safety of vaccines to more quickly allow for continued reopenings of businesses and schools. I do know that in a recent NRHA message that was sent out to the members, there was kind of a focus on perhaps increasing some coordination with stakeholders, external stakeholders, and community leaders, and that is one of the activities that will be supported via this particular grant. HRSA will fund, this is also very important, is that HRSA will fund all eligible rural health clinics and organizations that own and operate eligible RHCs that apply and have a complete and acceptable application. So for some grants, FORP requires that applicants be located in an eligible rural area. And for this one, you do not have to have any rural area location requirements. And that's because of the fact that the rural health clinic might be owned by an entity that is perhaps not located in that rural area, right? And when I say that we're going to fund all eligible rural health clinics, that means that if you submit the grant by the deadline, which the grant has not been released yet, that you will then, and it's a very skinny grant. So we're trying to make it as easy as possible for rural health clinics to apply and get funded, that you will be funded. Michael, did you want to talk a little bit more about the funding?
Yeah. So thanks, Lindsay. And, just to keep reiterating the point, this is the first grant program dedicated at rural health clinics. There is a lot of things that folks need to do to register in order to get a grant program. So we'll provide some more information after this meeting to Brock, and NRHA will be able to disseminate this information. And really what we're trying to say is that we cannot reinforce this enough, that parent hospitals can assist the rural health clinics apply for funding, and they can use this, basically the economies of scale, where at the taxpayer identification level, organizations can pool these funds, and then the funds are there. So they can be applied to just one of the RHCs or all of the RHCs. We'll allow the parent organization to decide how that needs to be best addressed. So I'll turn it back to Lindsay to sort of talk about what's coming up with this grant program.
Michael. So as I mentioned, the notice of funding opportunity is not yet open, but it will be open on grants.gov in the next few days. And that number, the funding opportunity, will be HRSA 21142. So you can feel free to search for that in grants.gov, and it should pop up. RHCs must apply in order to receive funding. So a program, the testing and mitigation program that I will talk about a bit later, that is one that you do not need to apply for, but for the rural health clinic vaccine confidence program, you must apply. The due date for the applications will be mid-June. And we suggest that you submit applications to grants.gov at least 3 calendar days before the deadline to allow for any unforeseen circumstances. I will also put in the chat the RHC Vax Confidence at HRSA.gov, which is, if you have any questions, you can feel free to email that. And then you can also join the RHC Vaccine Confidence Program mailing list for additional program announcements and updates. And HRSA will be hosting 2 rural health clinic vaccine confidence technical assistance webinars later this week and mid next week. Webinar information can be found in the NOFO or on www.hrsa.gov/coronavirus/rural health clinics/confidence. And I will also put that in the chat.
Lindsay, just to recap, the grant number again is what?
HRSA 21142.
That's HRSA 21142. All right. We had several people text in that question, so glad to get that down correctly.
Yes.
Lindsay, and you may have said this, and perhaps I didn't get it. What's the maximum award amount for this particular program?
Sure. So I'm actually going to toss that one over to Michael, and Michael can kind of talk a little bit more about that.
Thank you, Lindsay. So like we said, it's going to be approximately $50,000 per rural health clinic site. Now, what everyone needs to know is that this is contingent highly on how many rural health clinics apply. So the less rural health clinics apply, the higher the amounts will be. HRSA, however, will limit the maximum award amount to $200,000 per rural health clinic. But just because we don't know the number of rural health clinics that are going to apply, we basically created a floor and a ceiling. At minimum, it's 50. At most, it's 200,000.
So that's the range.
Yes, sir.
Yeah. Okay. All right. And once the application is made, how complicated are you expecting it to be? You said it was going to be relatively easy. I mean, I've had grant applications that could take days to complete. So yeah. Could you maybe give us kind of a guess in terms of time to complete the application?
Sure. So for all, I mean, we really are trying to, when I say this, I'm being really genuine that we're trying to make it as easy as possible for first time rural health clinics to apply. And so we anticipate the suggested page number is from 10 to 15 pages. But it can be less than that. It can be more than that. It's not, that will not, you know, and you're not at competitive advantage if you have less or more. We also will be giving some examples of the project abstract, the project summary, and you can feel free to use that language. We'll also be giving some work plan examples, and so you're encouraged to use that as well. There will be a specific template that you can use in order to put in your if you have more than one rural health clinic, that will just be fillable. So I would hope that it wouldn't take longer than a day to fill out. Hopefully less time than that, but that being said, I would encourage people to start the grant registration process. That means going on DUNS and getting your DUNS number, going to SAM and getting your SAM's number, and registering with grants.gov even before the NOFO posts. You want to be sure that you're all set to go and ready to kind of submit that application as soon as possible.
So a couple of questions, Lindsay. This is different from the $100,000 that is being deposited for RHCs. The person writing the question thought that there were two programs. One is automatic and one is a direct deposit.
So the Rural Health Clinic COVID-19 testing and mitigation program will be a direct deposit allocation of $100,000. That is specifically for, and we can talk about that a little bit more. I can certainly go over that. That's going to be specifically for Rural Health Clinic COVID-19 testing and mitigation. And it's basically an extension of the earlier funds, which were for Rural Health Clinic COVID-19 testing. We're hoping to give you a little bit more flexibility by adding in mitigation activities. And so that will be directly deposited into all eligible Rural Health Clinic bank accounts. If you have a updated provider of service, if you're located in QCore and the provider of service file as of April 18th. So yes, that is a direct allocation.
Okay.
This one is the Rural Health Clinic the Rural Health Clinic Vaccine Confidence Program you have to apply for. And then that funding, that notice of award will come out afterward, after you've applied and been awarded the money.
So if the hospital owns multiple rural health clinics, can they apply for the mitigation, the COVID vaccine program per clinic, and it's in one application, or would
it's one application? So for the RHC Vaccine Confidence Program, there will be one application per TIN entity. And you should put all of the CCNs. That's what that template is that I was referring to. There will be a template where you would, the TIN organization would put all of the CCNs into that template. So each RHC you should apply via your TIN organization. Should not submit individual applications for each rural health clinic.
Right. Okay.
And the funding will be distributed to the TIN organization, and they will be responsible for dispersing it to the rural health clinics or pooling the money if they think that is the best way to help the service area. But it is intended for the rural health clinic service area and those local communities.
And on the vaccine competence program, what would be the post-grant accounting responsibilities? What would be the reporting on the back end requirements, if any?
Sure. So they will be required to submit a post period of performance summary. Michael, did you want to talk a little bit about any of the other?
Yeah, I think the easiest way to say is that we are going to streamline as much data reporting and reporting requirements as possible. I think the general consensus is from HHS and just in conversations with National Rural Health Association and other rural health clinics is we realize the capacity that rural health clinics have to respond to many, many data requests. So I put in the chat window a link to a landing page that we have that discusses each of the programs we're actually going to talk about today. And though that doesn't give the detailed level of the data requirements and this kind of stuff, I think it'd be sufficient to say that what we will be requesting is a much lower bar than you would typically see from a federal grant, especially one out of HHS.
Very good. Well, we appreciate that. I know that will be welcome news to those on the line, especially after the provider relief funds experience for a lot of our hospitals. So
Yeah, and I think that to go along with what Michael said, like if there are recipients of the first round of RHC COVID testing money, you'll note that reporting portal is significantly less burdensome. And so that's kind of the angle that we're going for. We want it to be something that is really doable, that you can go in and kind of take care of that. So Michael, did you want to say anything else about the vaccine competence program?
Yeah, I think the last thing I'd really say is that that this is a huge priority for our office and HHS. We recognize that this is the first time that we are doing a grant program with rural health clinics. We recognize that, like with any grant program, there's going to be some hiccups, and this one will definitely have things, and that's an idea and a thought we built into the program. We will be providing more technical assistance during the implementation of the program. We'll be rolling out more assistance internally in the organization. I don't know how to rate it anymore that this is a massive priority for this office. We've been basically all hands on deck for these programs, and we really value the opportunity to work at the rural health clinic level. This is something that I know really the administration prioritizes as well.
Well, thank you for that. And I think certainly we would commit to whenever we need to have follow-up webinars or sessions like this, we'll certainly be able to get these on queue pretty quickly. So now I guess we got 2 more programs to review. Is that correct?
Yes, now is the Rural Health Clinic testing and mitigation program, which I'll also turn to Lindsay to talk about.
Thanks, Michael. So just a quick point. I think, Michael, the things that you put in the chat might not have gone to all of the attendees. I think they may have only gone to
Panelists.
the panelists. If you want to resend those.
I will send that all to everyone. Sorry, I am.
Thank you for that, Lindsay. It is hard. That's great.
I was just looking and I was going to resend them, but I didn't. Now he tossed it back over to me. So
no.
The Rural Health Clinic COVID-19 testing and mitigation program, which I've already kind of talked a little bit about, but that program is going to provide $460 million in American Rescue Plan funds to over 4,600 rural health clinics across the country. Rural health clinics will use the funds to maintain and increase COVID-19 testing, expand access to testing for rural residents, and broaden efforts to respond to and mitigate the spread of the virus in ways tailored to their local communities. So as I mentioned, this is the extension of the RHC COVID-19 testing program, which awarded $225 million in Paycheck Protection and Healthcare Enhancement Act funds to rural health clinics in 2020. And really, we're building on the success of that program. Rural health clinics have performed over 11.1 million COVID-19 tests at over 3,300 testing locations as a result of the 225 million that was dispersed in 2020. So congratulations to all of the rural health clinics who have done that amazing work. I mean, we're thrilled and very impressed. So these funded activities, though, we're trying to respond to some of the feedback that we've gotten from rural health clinics and make it more flexible in spending. So you can, with this $100,000 per rural health clinic in COVID-19 testing and mitigation funds will include testing education and establishment of alternate testing sites, the test result processing, arranging for the processing, contact tracing, case investigation. And then if you go to the CDC community mitigation framework, that is where we are basing a lot of our the eligible activities and the encouraged activities for this particular program to address the spread of the virus. And you can tailor those to your local communities. So we're gonna issue the RHC CTM is what we're calling it. We're gonna issue that funding in the beginning of June 2021, which will be via the provider relief fund mechanism. It's the same way that we did it in May 2020. So they're going to be one-time payments to organizations based on the number of certified rural health clinics they operate, providing approximately $100,000 per clinic site, and you do not need to apply for these funds. And one of the things that all RHCs that will be eligible for this, if you've met the reporting requirements for the RHC COVID-19 testing program, that means that you went to RHC testing, RHC, now I'm losing it, rhccovidreporting.com, excuse me, and have reported your numbers. That's supposed to be monthly. And if you have active CMS certification numbers or CCNs and are listed in either the CMS provider of services file or the CMS survey and certification quality oversight reports QCOR as of April 18th of 2021. So ineligible RHCs that are not current with their reporting on rhccovidreporting.com will have the opportunity to catch up for future program consideration dependent on the availability of funds. That is the same thing with newly certified RHCs that were certified after April 18th. And I want to just add in that in addition to providing funding directly to rural health clinics, we will also be continuing our funding of the Technical Assistance Cooperative Agreement that's led by the National Association of Rural Health Clinics. And has been supported by the National Organization of State Offices of Rural Health, so that rural health clinics and those rural hospitals that are participating in this will be able to kind of ask questions directly to them and get those needs met. And Michael, did you want to talk a little bit about the SHIP COVID testing and mitigation program?
Yeah, thank you, Lindsay. So sort of just really kind of working together in concert with the Rural Health Clinic COVID-19 testing program. We have the SHIP COVID-19 testing program. So HRSA is going to provide almost $400 million to existing grantees of the Small Rural Hospital Improvement Program. It's a grant program here at FRHP. We kind of deem it SHIP, P, not T. And to work with approximately 1,700 small rural hospitals, those with fewer than 50 beds, and critical access hospitals on COVID-19 testing and mitigation. Now, a lot of the framework of this program is extremely similar to the Rural Health Clinic testing and mitigation program. The only thing here is that SHIP state grantees will be able to use the funding to provide support to all eligible rural hospitals, and this time it's up to $230,000 per hospital. And it's to increase COVID-19 testing, expand access to testing, and communities broaden efforts to respond to and mitigate the spread of the virus using the framework Lindsay just talked about. So HRSA is going to work with the existing state grantees to finalize the list of the participating hospitals, and will issue the funds later in this year. And that's all I have for the SHIP 19 testing program. And if we don't have any questions, sorry, go on.
So to clarify on this particular program, theoretically, then the rural health clinic could get the $100,000 plus the hospital receiving the mitigation strategy grant through SHIP of 230. So it's cumulative.
Correct.
Okay. We had a question come in on the Q&A. Lindsay, our information was not updated in Q-Core until May. Does this mean we will not receive the $100,000? We've had numerous problems with our CHOW updates.
Sure. So if I'm not sure who it was that sent that to you, I would encourage you to just email us at this Rhc COVID-19 testing at HRSA.gov, and we can try to work with you. As of now, the payment file for that first round has been sent. So everything has to be current as of April 18th of 2021. But that does not mean that you are not eligible for the money. That just means that it won't go out at the beginning of June. And we're working with some other partners in order to come up with a good and acceptable date. I would anticipate that it would probably be about 2 months or so later. Michael, just so you know, I can see your screen. I think you just got out of the slideshow.
Okay.
But yes, you will still be eligible for the program funds. It just will not hit your bank account at the beginning of June. But
So
email us and we can try to work with you.
Okay, perfect. That's a good idea. So Brenda McKean, that would be a good source to follow up on to make sure you get those dollars. A question came in. What was the website that showed eligible expenses? Again, maybe post it in the chat possibly.
Sure. So the eligible expenses, we will be coming out with the terms and conditions for the Rural Health Clinic COVID-19 testing and mitigation program shortly. I would anticipate within the next few weeks, and probably earlier than that, to be honest. But we're trying to make sure that we have as much guidance for those terms and conditions at the same time, because we want to be able to give you as much information as possible. But you can reference the Centers for Disease Control and Prevention Community Mitigation Framework, and I can post that in the chat, or Michael might be able to drop that in there. The same testing terms and conditions will apply. However, we have tried to take away a few of the more troublesome things for those rural health clinics. So just keep on the lookout for that email. And then one of the things, I know that Michael mentioned this landing page with the 3 programs. I would encourage you to bookmark that on the top of your bar, because we'll provide updates via those links, as well as signing up for these listservs that I've just dropped in there, the COVID testing, and then the Vax Confidence.
So yes, CAUS are included in the SHIP program. So it's small PPS hospitals, 50 beds or less, and all CAHs. So that are, and the states are going to be, those are going through the state SHIP programs, correct, Michael? That's, yeah.
Correct. They're going through a state SHIP program.
Yeah. We had a question come in. Can a new Rhc apply for funds? I think you answered that, Lindsay. Just contact you guys and see about, what the details are, and maybe there's some exceptions or something.
Yeah, and I mean, we should also be able to, I encourage you to email us just so that we can pull your name out, because that's really the quickest way. But we do we do go into the provider of service file and the Q4 file. And we pull out those new RHCs that may not have been in that file from April 18th and prior. So all new RHCs after April 18th are still eligible for funding. They just will not be, they won't receive that funding at the beginning of June.
Okay, it won't be automatic and they won't receive it.
It will be automatic, but it will be in a second payment disbursement.
Right, yeah, that's what I mean. You have to go through a step to get access to it, yeah.
Correct.
The important question that keeps recurring, and I mentioned it earlier, in terms of keeping reporting relatively simple. And the questioner asked that I'm not sure if the vaccine confidence grants or the testing and mitigation funding or both. For the testing and mitigation funding, we've been reporting testing, but there will still be some financial reporting at some point, correct? Any insight on what that will require?
I would say that whatever financial reporting has been already happening is going to be consistent. We're not going to change the financial reporting from the first tranche of testing money from 2020. We're trying to keep it as, I think the reasoning is we're just trying to keep it as consistent, as easy as possible. It's the easiest way to get the funds out quickly. But we will be exploring ways to see if we can reduce any burden on rural health clinics and recipients of the funding.
Okay, perfect. Lindsay just put the website on the chat for the reporting, rhccovidreporting.com. So for those of you that had requested that earlier in a chat forum. I think we have one more payment program to go, or maybe we covered them all and I missed it. So
no, we do have one more program, and this is one that we're particularly excited about because we've really, I can attest that Lindsay's been working hard on this. It's our rural health clinic vaccine distribution program. So in concert with the Centers for Disease Control and Prevention, we launched the Rural Health Clinic COVID-19 vaccine distribution program. Clearly, we love really long program names. And a lot of this is to directly allocate vaccines to Medicare certified rural health clinics. So this is a direct allocation. So we know that we're seeing lower vaccination rates in rural communities. We know that providing doses directly to rural health clinics is a critical step in an effort to vaccinate as many Americans as possible. That rural health clinics really take an important part and role in increasing our vaccination rates. So you can see how all these programs sort of build in together. We have our testing program, we have our vaccine confidence program, and now this is actually distributing vaccines. And so HRSA and CDC will enroll interested rural health clinics to receive a direct allocation of COVID-19 vaccine doses. This allocation is in addition to any vaccine allotments rural health clinics may be receiving from their state or jurisdiction. This is directly from the federal government. So this program will provide the vaccines, the constituent products, any ancillary supplies at no cost directly to rural health clinics in this program. Now, participation is voluntary and it can be terminated at any time for any reason by the rural health clinic or HRSA. So if you feel like you're participating, you have as many doses as you want or need for your community, you can leave. That's it. So expectations for participation in this program, it includes reporting information and vaccine-related data to support the implementation of direct allocation. So a lot of this is just participating in existing CDC systems. And HRSA and CDC will provide technical assistance and support throughout participation. So we'll put in the email address for this program as well. I know that isn't a ton of information, but please let us know if you have any questions. And I think we reached the end of all of our RHC programs. So maybe we'll turn it over to see if there's any last questions.
Yeah, so we had a question. Okay, go ahead, Lindsay.
I was just going to add a couple of things to that.
Sure.
And because as Michael was speaking, I was thinking about it. So if you are interested, I would just encourage you to email that vax distribution email that I just put in the chat. Like if you're at all interested, or if you just want some more information, we will send you back the information, and you are under no obligation to, if you send that first email, to sign up and participate. Okay. So the other thing that I want to note is that the vaccine, you will have have the ability to request whichever vaccine works for your clinic. So as we all know, there are 3. So you can get Pfizer, you could get Moderna, or you could get Johnson & Johnson. The other thing that I know that some of you may have seen, some of you may not have seen, is that the FDA last week actually just revised their guidance as far as refrigeration for Pfizer. So that will hopefully make Pfizer more available and usable for rural health clinics, especially for those children 12 years and up. So definitely consider that. I know that there are some, every rural health clinic is different. We know that, right? But some rural health clinics have already partnered with public health, their public health department or so on. But if your public health department only has Moderna and Johnson & Johnson, and you really want to start getting that Pfizer and start to get your kids vaccinated, certainly send us an email and we'll try to help you out with that. And it's separate from your jurisdictional allocation. So if you get some from your health department, like, it's not taking away from that. It does not affect that.
Well, thank you, Lindsay. And I think that's an important contribution to our rural clinics to expand access to vaccine. And I know I've had personal stories, anecdotes told to me that people were definitely opposed to getting the vaccine until they went to their local clinic, and their doctor that they've been using forever insisted that they get it. And the good news is they had the vaccine right there to be able to give, so that they didn't leave without the shot in their arm. I will also point out that CDC has also issued guidance that it's better to break open a vial and use only a certain portion of the doses rather than to not give the doses at all. So don't worry about wastage, in other words, in terms of the storage issues that Lindsay just very capably talked about. And also that FDA did expand the authorization for longer shelf life for some of those that before now required ultra cold storage. There's a question that came in. I work at a state Department of Health and they were wondering about applying for the vaccine confidence program. But to clarify, do we as the state apply hypothetically and then disperse the funds to the RHCs? Or is this just the rural health clinics in the states apply directly themselves?
The TIN organization, or the organization that has the employer identification number or the tax identification number, they should be the ones who are applying.
Right.
So in some cases that might be the RHC, or that might be the provider for so those provider-based RHCs, those should be the entities that are applying for the RHC vaccine confidence grant.
I think I kind of confused things when I mentioned that the SHIP grants will be coming through the states. So that will be coming from a state and granted to the hospital. Everything else is directly to the rural health clinics. Okay. I'm looking down through the list. Now is the time where we have a few minutes. If somebody wants to raise their hand and be unmuted, they could certainly ask their question verbally, or we can, I'll be glad to answer any of them that are texted in. So
Brock, I already saw one from, I believe it's from NRHA, and the timing of the RHC direct allocation. So a lot of that just depends on how quickly the rural health clinic shows that they're interested in this program and fills out some paperwork, but that really can happen pretty quickly. So I would think within a couple weeks, the direct allocation can come out.
Yeah, and just to go off of that, I know that we have been trying to get those out the door as quickly as possible. So there is some paperwork to fill out, but then what we've been doing is that Monday, Tuesday, and Wednesday, we're trying to do some outreach to the rural health clinics and get all that paperwork taken care of and get the orders placed with the CDC. And then the hope is that allocation, that vaccine would be delivered to you the following week.
So we had a question come in. What if multiple requests come for the same geographic area to be served?
Can you
I
say
guess
that
I
again?
can-
I'm sorry.
Yeah.
What if multiple requests come for the same geographic area to be served? I guess I'm not sure which program.
So I think maybe what they're saying, so we will be verifying in the vaccine confidence grant that we'll be verifying TIN and CCN eligibility. So we will also be removing any duplicates. So do not apply with the same CCN in numerous grants, because that will disqualify you. So if that's kind of what I think, that might be what they're asking. But as far as a service area, if there's like, two providers that have rural health clinics and they're both located in the same county, but they have different tax identification numbers, that's not going to disqualify you. Not at all.
Okay, perfect. So we had a very interesting question posed in the chat. Our rural health clinic providers are leaning towards the Pfizer vaccine, but the least amount that you can order is 1,172 doses. We only have a small freezer for storage. Do you know the approximate size of the Pfizer package? We're basically concerned it would not fit all the doses. I would presume, and I'm going to just pose the question, that for the vaccine confidence program, that's part of what the $100,000 could be spent to accommodate, correct? Storage for.
So you can use that. I think it's kind of hard to discern because sometimes there's so many programs now with so much funding. What I'd say is the rural health clinic testing and mitigation program that allows some more flexibility in terms of structural things and things like buying a freezer, buying stuff like that. So that's an approach I would take. And since everyone is eligible, all rural health clinics are eligible for that funding, I would just really wait to look into that one. That said, we recognize that there are a lot of programs and people want a lot of specific information about what they can and cannot answer. And, the emails that we put here can help with that. But a lot of times it's just reading the existing documentation we've sent out, the terms and conditions, that should help out a little bit with that too.
Right. And to add to that, what Michael said is completely right. So because of the way that the American Rescue Plan, that the statute was written, these cannot be used for the vaccine confidence program, and testing and mitigation cannot be used for direct shot in arm.
Right.
However, we are very much encouraging rural health clinics to be creative in the way that they do everything else to get that person into the doctor's office and put the shot in the arm. So if you want to get Pfizer in order to provide that for the kids that are 12 and up, just take that into account.
Yeah, I think that's very good advice. And I think that clearly that would be the flexibility you were talking about to be able to make those things happen. I saw a question come in and I'm not having an easy time finding it again, so I'll just paraphrase it. There was a question about Medicare, pediatric rural health clinics. And does this apply to them? And I'm going to say yes, as long as they're a rural health clinic. Yeah.
Yes.
Okay.
Yes.
All right.
I do think there might be some, and I'm not sure if in the question and answer, there might be some, I'm not sure if we've answered those. But the NOFO is not posted yet, just to reiterate that. It will be posted hopefully early this week. And then the informational webinars, there will be one later this week and then early next week. So just sign up for that listserv or email the Vax Confidence. And then you should be able to, excuse me, we'll send out some alerts for that. Or you can always just go and visit that website landing page and we'll put that up there too.
Yeah, I saw it, and there was a question that came in that they're not an official RHC, but have a DUNS number and registered with grants.gov, that they are targeting a 50%, 56% rural according to the US Census. I'm guessing if you're not a rural health clinic, a certified rural health clinic by definition under the 1978 statute, you would not be eligible. Is that a safe statement?
That's correct.
Yeah. What is the allowable time frame for expenses?
Sure. So this is exciting. We got some new policy guidance. So the first round, the Rural Health Clinic COVID-19 testing funding, so the $50,000 will need to be expended by December 31st of 2021. The $100,000 in the COVID-19 testing and mitigation program will be 1 year after that. So the expend by date would be December 31st of 2022. And that will be written specifically in those terms and conditions. That's one thing that we had heard from RHCs is you guys just want that definitive end date. And so the last day of reporting on rhccovidreporting.com would be the following month, so January of 2023. And for the purposes, if anybody, is for the purposes of the first round of funding, the last day of reporting for that $50,000 would be January 31st of 2022.
A lot of dates.
Pardon?
Is that a lot of dates?
Yes, that's a lot of dates. We will be putting that up on the website, just to be clear. All of this information will be available.
So the timing of the RHC direct allocation, this question came in a few minutes ago, and I think you answered it, but just to refresh our memories, that's the 100,000, I'm presuming.
No, the distribution, the vaccine distribution has, the vaccine confidence is the 100,000.
Okay.
No. The vaccine confidence is 50,000.
You're right. Yes, the vaccine confidence. Sorry. Yes.
No, that's okay. It could be, if we have less people apply. So you're not definitely. But the vaccine, the testing and mitigation funds will be distributed at the beginning of June, directly into your account. The vaccine confidence program you must apply for, and that NOFO will be posted this week. We will be hosting a webinar. I don't have the exact dates. I apologize. One webinar will be late this week, and we will have another webinar next week. We also, it's a holiday weekend, so we understand that it will not be on Monday.
Right. Interesting question. Will any of the non-expensed $100,000 be taxable? That's close beyond, I guess, our ability to.
Yeah, I think beyond our ability for the webinar, but please put it. Yeah, by all means, submit the question.
I think that's probably for the accountants to decide in terms of audits. All right, yes. I'm looking.
Oh, both webinars will be repeated. And we will also repeats of the same information. We will also post that webinar after the fact. It will be available 24 hours after. And you can find that in the NOFO. It will be linked in the NOFO, and it will be on the website.
Well, I think we're coming to the end of, unless there's any closing comments. Michael, Lindsay, anything that you'd like to say as we begin to wrap up?
I would just say that we recognize there are a lot of different programs that we've just discussed. This webinar, like Brock said, it's going to be put on, it's going to be live and they'll be able to post it. Like Lindsay said, we have 2 upcoming technical assistance webinars coming up, and that there is a lot of information on the web pages, and as each program sort of proceeds, so as the funding opportunity comes out, as the testing and mitigation funds come out, as the distribution program sort of proceeds the next few months, the websites will be updated too. And at all times, the email addresses will be at the bottom. There's always someone reviewing the email addresses or at those email boxes, and there will be someone who will respond back.
Lindsay, anything that you'd like to say as we close up?
You know, I think Michael pretty much covered it. I really appreciate everybody's patience and understanding. Like Michael said, we know that there are multiple opportunities. It's great. It's really great and it's exciting, but it can be confusing. So if you are, you know, if the programs get a little bit mixed up in your mind, go to that website and that landing page, and it should help clarify. Or feel free to email any one of those email addresses, and we can direct you to the right person or the right inbox.
Yep.
Very good. Thank you. Mark emailed a question in about the provider relief funds. I know we've not at NRHA heard of any updates to the 6/30/21 deadline for reporting. Once we hear something from HRSA, we will be the first to get that news out. And then Mark did just text in to say that, yes, it is taxable. So sorry about that, Meta, but I know it's probably not good news. Anyway, I am just extremely grateful to my friends Michael and Lindsay from the federal office to be able to review with you all of these opportunities. I can say that without a doubt, this is not part of what probably F4HP was planning on doing as of a couple of months ago. So
that's correct.
So this is something that we are so thankful for their stepping up and being able to get this money out the door in such an efficient fashion. So our kudos to them and our thanks and appreciation go to them. So for going through this webinar today, we appreciate this information. And I'll offer that if we need to get on the horn and do something like this again down the road to clarify any issues or to update you on information, we'll be glad to do that. This is a recorded webinar. I will, and I've had a couple of notes in the chat about that. We will post the link to the replay. And that way, in case you miss something or you have friends and neighbors that might want to hear this, you can share that with them. Thank you all very much, and I hope everyone has a wonderful week and an even better Memorial Day weekend coming up. Thank you.
Thank you, everyone.